Hi, everyone. Apologies for the stand-up comedy mic for today. The one that clips on your belt doesn't seem to be working, and we are trying to record this with Panopto for people to watch later who couldn't make it, potentially those who planned to come last week, which we had to postpone the session due to the apocalyptic cold, right? So thanks to those of you who were able to make that adjustment and be here today. I'm Peter Locke, a faculty member in Global Health Studies, and really happy to welcome you to this event and our ongoing speaker series, generously supported by the Provost's Hollister Lecture Fund. Before introducing today's speaker, I want to quickly promote our next event in the series. On Friday, February 20th at noon in this space, 555 Clark B01, we will host physician and medical anthropologist Claire Wendland, Vilas Distinguished Achievement Professor of Anthropology at the University of Wisconsin-Madison, for a talk entitled Suffering Humanity and Scientific Medicine, A Global Health Ancestry Story. Dr. Wendland will be sharing her recent work on early 20th century African intellectuals engaged in global debates around race and health, focusing on Malawi's first medical doctor. Now it's my pleasure to introduce our speaker today, Dr. Kelly Hunter, currently a postdoctoral scholar in Northwestern's Department of Political Science. Prior to arriving at Northwestern, Dr. Hunter was a junior visiting scholar at the University of Oxford's Nuffield College and a Global Health Institute doctoral scholar at Duke University, where she obtained a joint PhD in political science and public policy. Dr. Hunter explores the politics of global health and the ways in which policies, interventions, and conflict impacts women's sexual and reproductive health outcomes in low and middle income countries. Through both quantitative and qualitative work with communities in rural Western Kenya, Dr. Hunter's research highlights the interconnectedness of gender, health, and international politics and shows that changes to healthcare access produce life-altering results. Dr. Hunter's talk today is entitled Global Health Politics in the Post-USAID Era, Lessons from the U.S.'s Global Gag Rule and its Impact on NGOs in Kenya. Let's give her our warmest welcome.
Okay, thank you for that. Yes, I do talk with my hands a lot, so we will try this microphone thing, but I don't know how I'll fare. Anyway, thank you for being here on this snowy day. I appreciate you coming out, especially after it was rescheduled. I'm going to start out with a little outline. I was going to give an intro, but obviously that's already been done, so I don't really need to tell you anything else about myself, so I'll just jump into the rest. I want to put this research project in context. Then I'm going to talk a little bit about USAID. I'll talk about my research question and the application, the policy known as the Global Gag Rule. It's more formally known as the Mexico City policy. I'm going to talk about the setting, which is Kenya. I'll talk about the U.S. Global Gag Rule and its impact on NGOs, what we already know. Then I want to talk about what political science can teach us. I'll go over my data and methods, talk about my results, go ahead and give my conclusion, and then I will tie in my field work that I did in 2025, so just this last summer, that were some follow-up interviews with these same NGOs about USAID. So start with USAID, and then I'll come back to that again at the end. Okay, so as the intro mentioned a little bit, I have lots of other projects and methods that I work with. I do a lot of work on intimate partner violence and women's empowerment. I designed and implemented a household survey with survey experiments and conducted qualitative field work in rural Kenya. I also have some work on rural health and political mobilization, where I do some comparative analyses using survey data between rural Kenya and the rural US. I've done a lot of work on physician-led voter mobilization efforts here in the US and conducted 2 randomized control trials leading up to the 2024 election. I also have done a lot of work on aid withdrawal and health. You'll see part of this work today, but I've also done this work in the context of large N analyses of aid sanctions and how those impact women's health in a variety of countries. And then today, I'm going to really focus in on my qualitative field work that I've done in Kenya since 2020. And then I just want to give a little note about ethical research practices. All of the photos that you will see in this presentation were obtained with consent. None of the individuals or organizations pictured in here were actually participated in this study. These are all pictures from a different fieldwork project, so I just wanted to be very clear that there is anonymity still here involved. This, for IRB purposes, the Duke IRB approved this study in the earlier iterations, and then for the most recent 2025 fieldwork, Northwestern IRB claimed that it was exempt, so we've crossed all of our T's and dotted all of our I's there, and then participant consent was obtained at the time of interview with all of these individuals. Okay. So starting about a year ago, USAID kept cropping up in the news as cuts were made, as the agency was being threatened to shut down, as workers were fired. All of these things happened. We all remember. I'm not going to dwell on the timeline of that, but it started in late January, early February, and then on July 1st of 2025, USAID was officially absorbed by the Department of State. USAID accounts for about $40 billion a year of the US budget, and that is less than 1% of the US budget. I like to point this out because political scientists, when doing polling and things like that, when asking about foreign aid and how much, does the average person think goes toward foreign aid, your average American will say something like 20% of our budget goes to foreign aid or something like that. That is absolutely not true. It is less than 1% of the US budget. But however, that $40 billion a year of USAID is huge. It is the U.S. is the largest donor in absolute terms, and its funding has a really high impact on low and middle income countries. I want to put this in context. So here I have a few charts that I'm going to show from other sources. This one's Our World in Data. How much did the largest 10 donors give in foreign aid in 2023? You see here, the U.S. is the largest. Now, you see 62 billion. I just said 40 billion. This is all foreign aid, foreign assistance. The previous slide, I was talking about USAID specifically. So USAID is the bulk of U.S. foreign assistance, or was the bulk, sorry. But you can still see on every measure, the right-hand side with the red markings, that's in terms of absolute dollars. And then the bluish turquoise, that's in terms of a share of gross national income. So as you can see, we don't give as much proportionally as, say, Germany or Norway, but we give the most in absolute terms. And it's been like this for a long time. You can see the US is that purple line, and all except for this period of time between the 70s and 80s, right? We were the largest donor. And then finally, this graph from the Center for Global Development shows what percentage of global health funding, sorry, let me say this again. This is how much of the budget of their health budget comes from foreign assistance, and specifically from the US. So places like Afghanistan, the US is contributing almost 350%, right, of their health funding, right? But it's still a lot. In Kenya, it's about 25%. So it doesn't seem like a lot when you compare it with that side of the graph, but in reality, it's still 25% of their health budget this is the government health budget, comes from the US. So this withdrawal of aid of USAID has a huge impact on these countries that rely on the US for a lot of their government budget. Okay, so my question that I'm asking in this study is, what is the impact of aid withdrawal on NGOs, right? We have a lot of work that talks about how aid withdrawal will impact health outcomes. We have a lot of work on how it impacts disease spread and things like that. But NGOs are the middleman, so to speak. They often do a lot of service delivery. And so when the funding is withdrawn from them, it impacts them as well. So I wanted to really dig in and try and figure out what's going on there. So the application that I'm using is the U.S. Global Gag Rule and its impact on NGOs in Kenya that provide sexual and reproductive health advocacy and service delivery. And so we're going to start, I'm going to do a little table setting, and we're going to talk a little bit about the U.S. Global Gag Rule. This is a policy that says no U.S. foreign aid contributions will be given to NGOs that perform or promote abortions, even if the organization uses non-U.S. funds for those purposes. So I can be an NGO, I can have funding from the U.S., I can also have funding from, let's say, the Netherlands. And if I want to use my money from the Netherlands to perform abortions, but I want to use money from the U.S. to give out contraceptives, that's still not okay, right? As long as you're getting any money at all from the U.S., when the Global Gag Rule is in effect, it says you're not able to perform abortions at all for your organization, or not just perform them, but also promote them. Okay, so the Global Gag Rule was first implemented in 1984 under Ronald Reagan in Mexico City, which is why it has that term, the Mexico City policy. It is repealed by every Democratic president and then reinstated by every Republican president. And it has happened within days of inauguration every single time, like clockwork. So we call that kind of an exogenous shock. This means that it is a funding decision that is made domestically within the US, but it impacts what's going on the ground in the low and middle income countries that receive the funding. It's not money that is withdrawn because there's no longer a need for it in the low and middle income countries. It's withdrawn because of something that's going on in the donor sense. So it presents an exogenous shock to what's happening on the low and middle income countryside. Okay, and just so you can see what I mean by this, I know this is an earlier iteration of the Global Gag Rule, but this is from another paper that I've done that's more quantitative work on the Global Gag Rule. When the Global Gag Rule was implemented in 2001, you can see that U.S. aid to the family planning sector, because this is the sector that's most impacted, right, went down by quite a bit. Now, it did not go away completely, but it definitely decreased. You can also see that the U.S., just as they were the largest donor of foreign assistance overall, like I showed in the earlier slides, they are the largest donor for family planning as well. These are the 10 largest donors, and as you can see, the U.S. gives over 10 times the amount as the number 2 donor. So let's talk a little bit about why this would matter in Kenya, right? So Kenya has a really strong NGO landscape. And what do I mean by that? Well, scholars have talked about how NGOs provide a lot of necessary services, and they're actually viewed as an extension of the state. NGOs in Kenya partner with the health system. Kenya's health system relies heavily on outside donor funding, as I showed in that other graph. And NGOs provide a referral base to health clinics for sexual and reproductive health. In particular, sexual reproductive health NGOs have a strong relationship with the government. They've worked together on cervical cancer collaborative initiatives over decades, and so the government and these SRH NGOs really work well together. There are also sexual reproductive health protections in the Constitution. Abortion in and of itself is circumstantially legal. That means it's not legal under all instances, but it is not illegal either. It is allowed in Kenya with medical recommendation, and it is it can be fairly easy to obtain an abortion in Kenya. So we're talking about an area that having funds withdrawn for abortion would actually make a difference, because there are abortions occurring in Kenya. There is also growing support for sexual and reproductive health. For example, the Nairobi Summit ICPD 25 was held in November 2019. That was the 25-year anniversary of the original International Conference on Population and Development that was held in Cairo. And this was sponsored by the governments of Kenya and Denmark and UNFPA. So again, this is a climate that's pretty conducive to sexual reproductive health and rights. So what do we know about existing health science research on the US global gag rule and NGOs? Well, we know that there's a record of health services disruption. For example, some scholars have found that it limits health service delivery, such as contraceptive training and accessibility. I also found this in a study that I published with my 2 undergraduate research assistants. If people want to talk about the health service disruption component, I'm happy to do that in the Q&A. I'm not going to go over it for this presentation, but I can talk about that later. Existing research has also found that the global gag rule strains partnerships with NGOs. These scholars found that it weakens collaboration, it splits partnerships between US-funded and non-US funded NGOs. So what I'm trying to get at here is I'm wondering, what are the mechanisms driving this change in the NGO relationships? And you see here that they talk specifically about US-funded and non-US funded NGOs. So I have just like a simple diagram to kind of lay that out. So imagine, maybe it's not so simple. Okay, so imagine there's 2 sets of donors. So here we have a donor on the right, that's the US, and here we have donors on the left. These are non-US donors, so any other country or organization, okay? And then we have 8 little NGOs here. Half of them here are getting funding from non-US donors. The other half are getting funding from the US donors. So as you can see, they have these vertical relationships, right, with their donor. But then also they have these horizontal relationships with the other NGOs. And so I tried to color code these, but you can kind of not tell the difference between the two when it's big like this. But you guys are all smart people. As you can see, like, right, we can have inter-NGO relationships within the donor, the US donor-funded NGOs, but then also we can have inter-donor or inter-NGO relationships with, like, for example, NGO 2 and NGO 6 over there. One is a non-US donor and one is a US donor. And so that is what they were talking about in that earlier slide. It fractures these relationships, these horizontal relationships between those who are funded by the US and those who are not funded by the US. Okay, I'm seeing people nodding their heads, so I'm guessing the earlier giggles about my simple diagram, I've assuaged your concerns and you're following with me. Okay, so I want to talk about that fracture, okay? So there's a theoretical framework, a couple theoretical frameworks that I think can help us explain this within political science and economics, and that talk about these inter-NGO relationships or these horizontal relationships. And the first is political economy of aid. So Cooley and Ron have a very seminal article from 2002 that talks about the NGO scramble. And basically, they argue that the foreign aid landscape is competitive and it's insecure and it's uncertain. And so because of this, NGOs are going to be scrambling for funds and they're going to be competing against each other. Specifically, they talk about it being insecure for 3 different reasons. One is principal-agent issues. This is the only one I'm really going to talk about, and I'm going to just give like a brief explanation about it. But this is, with principal agent, the principal is the donor, and then the agent is the NGO. So the agent is sent by the principal to do the principal's work, right? So the donor is saying, I want to give money for health, but I want to give money to decrease teen pregnancy, right? But I'm not going to be the one to actually go down there and do the work, so I'm going to send you, the agent or the NGO, to go do the work, okay? So that's the principal, the agent, and then they got the work to do. So there's hidden action and information when there's a principal and an agent. The donor goals might not really be compatible with the NGO goals. The NGOs might obscure information in self-interest. Donors try and reduce agent slack. That's when the agent going off and doing their own thing. They try and reduce that by monitoring and enforcing what's going on. This is a big issue in political science that we talk about in lots of different contexts. That is not the most thorough example you'll ever hear, but it's sufficient for this, this presentation. There's also a couple others that I'm just going to breeze through, but I'm not going to talk about the multiple principles problem and then competitive bidding problem. So aid withdrawal via the global gag rule exacerbates the principal agent problem, which makes inter-NGO collaboration less likely. I will go into more detail on this specific thing in later slides, so keep that in mind. Another theoretical framework that we can draw from in political science is role theory. Again, this is going to address the horizontal relationships. And it's based on this idea of role conception, which is shared beliefs in the proper purpose of specific collective actors. Role conceptions predict inter-NGO cooperation or lack thereof. When you have NGOs with similar roles, they're more likely to cooperate, but NGOs with dissimilar roles will limit interactions, and NGOs with completely incompatible roles will have competitive or hostile interactions. So basically, aid withdrawal via the global gag rule divides these NGOs into categories that advocate for and provide comprehensive sexual reproductive care and those that cannot. And this limits opportunities for inter-NGO collaboration between these two distinct groups. And now I want to talk a little bit about those vertical relationships using the concept of health diplomacy and soft power. So health diplomacy is health-centered foreign policy. This is foreign aid and or cooperation to health programming meant to promote health or foreign aims that are not health-related. Some examples include the US's PEPFAR program to fight HIV/AIDS, WHO contributions, or like individual countries' contributions to the WHO, mass vaccination programs, contributions to things like Gavi, US aid for health programming. These are all examples of health diplomacy. And then foreign aid is also a form of soft power. It acts as such when there's exposure to the foreign aid, attribution that the foreign aid actually comes from a certain country, and there's the affect and then the ideological alignment. And we know that USAID very famously stamped everything with like from the American people, right? Like you see these like food bags going out to places and it says from the American people. So they were really, this was a form of US soft power to get exposure, to make sure it's attributed to the US, things like that. So aid withdrawal via the global gag rule is a negative form of health diplomacy, and that could decrease US soft power by changing NGO perceptions of the US and thereby impacting the NGO donor relationships or those vertical relationships. Okay, so to sum, my argument is that aid withdrawal impacts NGOs' horizontal and vertical relationships. And it affects the horizontal relationships in two ways. One is through these principal agent issues that constrain US-funded NGOs. The donor demands and heightened monitoring alter the NGO's purpose and activities. US-funded and non-US funded relationships suffer. But because of role theory, the role conception as providers of and advocates for comprehensive sexual and reproductive health fortifies those non-US funded NGO relationships. So the ones that were on this side get fortified, whereas the ones that were going across the two axes sort of they suffer. So since health aid is a form of health diplomacy, I'm also arguing that the global gag rule alters the vertical relationships between NGOs and donors. Okay, so down to my data and methods. I did key informant interviews, a convenience sample, snowball sample, purposeful sample. I talked about 6 different topics, and this was me and then my 2 undergraduate research assistants. This was in 2020 through 2022. Finances, operations, relationships, services, the sociocultural climate in Kenya, and then COVID. Again, I have results on that. I'm not going to talk about it here, but if you have questions, I can talk about that in the Q&A. For analysis, I used in vivo and deduce, which are qualitative coding programs, and I used deductive and inductive coding approaches. So here's how this broke down. The bulk of these interviews were done during 2020. You'll notice the first set was done in person in February 2020. I landed back in the US on February 29th, just in time for all the fun to begin. So anyway, I was able to do those. I was supposed to go back that summer. We all know how that turned out. So we shifted to Zoom interviews. A number of Zoom interviews were done in April. Another round were done in July through October. And then in March of 2022, I was finally able to return to the country for research purposes, and I was able to do a few more follow-up interviews. So this is a total of 55 interviews. As you can see, it's a mix of sexual reproductive health NGOs, government health officials, physicians, researchers, a pharmacist, and then a few international sexual reproductive health NGOs as well. So the results. What's the impact of aid withdrawal on horizontal partnerships? Specifically, this is with the US funded and the non-US funded. So how were those relationships fractured? Well, I found that principal monitoring alters the NGO's purpose and activities. So I'm not gonna read through all these in the interest of time, but these are, and you'll see, I have lots of quotes that I'll be showing. I've graded some out just so it's not too distracting. And each quote that I have here is just a representative of many, many more quotes in my sample. So I pulled some that explore this theme or are indicative of this theme. In speaking about the local USAID office, one of the NGOs that I interviewed said to me, a lot depends on who is on staff, what their understanding is, how they're interpreting the policy. There's a disconnect with some missions and the main office. We want to make sure we're not breaking any rules, but not over-implementing. We wonder, is this okay? Fear and confusion still exist. So this was an NGO that was still receiving funding from USAID. Remember, I said not all of the money goes away, but a lot of it goes away. They were still receiving some money, but it meant they couldn't perform abortions or promote abortions, and they were still confused about what exact actions they could take and couldn't take. There was more monitoring. And then they said, the global gag rule has affected advocacy because the people who are going out there to talk about abortion are always wondering about saying the right thing. So they always had that in their mind. They always knew they were being monitored, and they were concerned that they were going to use their funding, and it changed what they were able to do. I found that it stifles collaboration. Here's an example. Before 2017, when the global gag rule was introduced, the US didn't care about what you did with other donors. But from 2017 till now, NGOs must disclose all programs and funding sources. USAID looks at past activities since 2017. So again, more examples of them being monitored and being concerned about who they were working with and what that would mean for funding. I found that US funded and non-US funded NGO relationships suffer. This greater principal monitoring introduces barriers to collaboration between these heterogeneous organizations. They said it's very difficult to call the gagged organizations for meetings. This is an organization that did not have US funding. Was saying it's very difficult to call the gagged organizations for meeting. If an organization at the meeting works in abortion services, you cannot take any pictures. The gagged organization will not officially register their presence. Even sitting in a meeting will put them at risk for losing their funding from the US. And they said before the global gag rule, all organizations would move swiftly together with force without any fear. But since the global gag rule, other organizations getting money from the US said they could provide us with information, but they wouldn't be at the front line advocating for issues because they feared losing money. They can offer technical information and service like guidance, but they want to stay out of the limelight. So these organizations that had been working together were no longer really able to do so. I have one more slide on that, but I'm gonna skip it. It's all saying more of the same thing. And then I want to talk about the non-US funded relationships and how those got stronger. So I found that the shared identity of providers of and advocates for comprehensive sexual and reproductive health really brought them together. They said, because we're in one network that is safe for safe abortion and lifting the penal code, we are not necessarily competitors. We have a vested collective interest, so there is little competition. They said NGO relationships have been affected. We are working in consortia and networks. They said we have good, growing, strengthened partnerships. We are energized. We are fighting a common evil. You may recall or not, but when I first introduced the study and talked about my data collection, I did not have anything, we were not asking any questions about cooperation necessarily. This was a theme that emerged, and we were really kind of surprised to see that over 2/3 of the organizations talked about cooperation. It was like a big part of the interview. So this was definitely like a surprise that we didn't think we would see. They, in fact, even established a formal consortium of 26 member organizations. They decided to advocate for more financing, promote primary health care, build capacity, and link and learn. And they said in 2018, one example of what they did was when the government had a ban on billboards that affected Marie Stopes, the Alliance collaborated to advocate to lift the ban. So they had a lot of successes, and they worked together. And when I went back in 2022 in person, I talked and asked some follow-up questions about the Alliance, and they said that network on how to handle the global gag rule and its challenges, how to manage those challenges, it's still active, but it's moved its issue to the East Africa Reproductive Health Bill and combating opposition to sexual and reproductive health. So even after the global gag rule had been appealed in 2021, they were still working on other issues together. So there was some longevity for that cooperation. And then how does it impact the vertical NGO donor partnerships? I found that, and this again is not surprising, right? Due to the global gag rule, NGOs have negative perception of the US. They said people believe that the US should be a stable government, and at the USAID funding behavior contradicts that belief. USAID is not seen in a positive light. There were many, many quotes like this. And I found that NGOs strengthen ties with other countries. This one I thought was particularly interesting. The NGOs seek funding from other places we hadn't gone to yet. BRICS. This is Brazil, Russia, India, China, South Africa countries. Places different from the US. We are thinking hard long-term since the US isn't reliable. As a political scientist interested in international relations and geopolitics, I found it very interesting and disconcerting that they were reaching out to two of the US's geopolitical rivals there, Russia and China. So this is definitely a shift away and shows that a decrease in US soft power there. So in conclusion of this part, and then I'll circle back to the USAID stuff. The key contributions of this work, I think, is that it shows consistent negative impacts of the global gag rule. My findings in Kenya support similar findings from health sciences research in other countries. There's changes in relationships, both horizontal and vertical. But I go a little bit further and I talk about the mechanisms that drive changes in NGO relationships. I talk about the horizontal relationships, these principal agent issues, and then how role conception fortifies the relationships among the non-US funded NGOs. And then also I talked about the vertical relationships. So coming back to the end of USAID, we had the work on the global gag rule from 2017 to 2021, and then we have the just complete withdrawal of USAID funding in 2025. There's some similarities, right, and some differences. So I want to talk a little bit about that. They're both instances where there's a high reliance on US donor, massive aid withdrawal, and no exit strategy. For vertical relationships, I would expect to see similar effects. And horizontal relationships, the role conception could fortify partnerships and collaboration between similarly focused NGOs. But there are some differences. While this is widespread and it affects multiple sectors, not just family planning, right? The earlier global gag rule just affected the family planning funding. And the horizontal relationships, NGOs who received the US funding, they're no longer subject to principal agent dynamics from the US because the US is no longer a principal, right? So they're not going to be monitoring or enforcing. And then, so perhaps without donor demands and heightened monitoring, there will be fewer obstacles to cooperation. But again, the NGO scramble, that political economy theory, predicts that with fewer overall resources, and of course now there are definitely fewer overall resources, NGOs will compete. So you can see it going kind of either way. My June 2025 fieldwork with follow-up interviews post the USAID shutdown. I am going to talk about what is the impact of the 2025 USAID shutdown on NGOs, and are the global gag rule related findings on NGO relationships applicable, and then what lessons from the global gag rule can be applied more broadly. In June 2025, I went back to Kisumu. I interviewed 21 individuals. Most of these were at sexual reproductive health NGOs, 15 unique NGOs. There were a couple people that I interviewed from the same NGO. And then there was one government county health official, and then 3 individuals on the county NGO coordination board. As you can see, the bulk of these NGOs received funding from USAID, and then those that did not receive actual direct funding from USAID, those 2, they did receive support from their partners who were receiving USAID funding. So they were tangentially involved, if not receiving like direct funds. The timeline, just so everyone is aware, they received a stop work order at the end of January 2025. Over half of the interviewees reported chaotic communications and a withdrawal process. One person told me there was no communication at all, it was just black. Many people reported this, but this was one quote that I thought was telling. Some of the NGOs were told that they would be under review and they could continue with modifications. These modifications were things like no DEI, no abortion, no gender ideology, no working with LGBTQ+ organizations, but then later all of the funding was revoked. So it was this sort of yo-yo situation. In fact, that particular interviewee told me that they fired a couple people, a week later hired them back, and then had to fire them again like 3 weeks later. So it was very chaotic. And then 1/4 of the NGOs, when I saw them in June, 1/4 of the NGOs were still waiting on reimbursements from January. Okay, so here's a quote. Who is affected now? Almost everyone, every household, every organization is affected. Today, I'm gonna break this down into 2 categories. I wanna talk about health service delivery. One of the quotes here is, there is suffering. We cannot give services as we should to the community. And then I want to talk about the financial aspects. We still have debts to pay. We didn't pay rent in January. We didn't pay staff. We didn't pay utilities. We didn't pay for trainings. Again, these are just samples. I have many more quotes like this. So let's talk about the health impact. One organization told me, we were supporting 18,000 infants and vulnerable children in 3 counties living with HIV. From February to now, 10 children have died. And those are the only ones that they knew about because they no longer had the resources to go door to door. They had been going door to door to make sure everyone was taking their antiretrovirals. They had access to those, things like that. They no longer had the staff or the antiretrovirals to do that. And they had heard through the channels that 10 children had died. That was most likely a minimum. There are some other aspects that you might not think about. Yes, deaths from USAID have been in the news, but this is a really big one too. The Kenya Health Information System cannot be accessed. It was funded by USAID. So some of these clinics were unable to even look at records. Again, someone said we couldn't access the electronic medical records because the donor provided internet access. Others told me HIV cases are rising, gender-based violence is rising, teen pregnancy is rising. Malaria funding was cut completely. Those gains in malaria control and prevention are now back to 0. And HIV and TB are donor supported. The government uses their money for other things. The implication there is, the government's already funded other things. So when the money for HIV and TB go away, there's no extra slush fund to fill in that gap. I have some quotes here that quantify some of the program losses. This was from an organization that makes sanitary towels or sanitary pads. They said their production is not meeting our goal of 10,000 a month. Our plans are halted because USAID shut down. Period poverty is a real thing in rural Kenya, and I'm sure many other parts of the world, but I can tell you multiple people told me how not having access to sanitary protection meant an increase in gender-based violence and an increase in teen pregnancy, because young girls will literally engage in sex for pads. That's how desperately they want that. So when this, organization that was able to produce previously 10,000 pads a month is not able to do that, that's the difference between a 13-year-old girl ending up, raped or pregnant. Someone said we had an online campaign reaching 200 plus people with disabilities, and we're not able to follow through with the results. This was an organization that was working on an initiative to make community centers more inclusive, which is very hard. It's a very hard place to live for people with disabilities, and so this is a really important initiative, and to think that 200 of those people were impacted is really sad. An LGBTQ health clinic that I worked with said we had 3,000 men having sex with men getting services, and 200 were getting ARVs, and they were no longer able to provide that. That's a lot of places, that's a lot of people in a place where HIV has come down a lot in recent years, but it's still higher than it should be. And then finally, a group that was working on online sexual reproductive health education and an anti-gender-based violence. They're cutting me off. Oh no, there it is. I thought this was like the Oscars. They're going to play the music and I had to go. Okay. Where was I? Oh, we were looking at directly reaching 5,200 people in the first year. And that was over. They had just been approved for their funding, and they were just about to start, and then that was taken away. There's also an economic impact. This is the front. To cooperate. Everybody is affected. There's a lot of panic. There's the need to work together as a team, no silo work. Organizations appreciate that the little you have can complement and support a lot. At the county level, partners were called to discuss areas where they could extend their support, replanning their activities. How can we synergize? Here was an example. The HIV partners are not affected by USAID said, you reduce your area and we'll take over your facility. That sounds like a threat, but it was not meant in a threatening way. It was a, hey, we know you can't do the work that you were meant to do right now, so we're gonna come in and we're gonna help you. I met with someone who said 12 LGBTQ organizations had a general council meeting yesterday and had an in-depth conversation about how to sustain the utopia we had. I don't know. It's hard to talk about as I'm thinking about these people that I know and that I've followed since 2020. I don't know that anyone in this room would call the LGBTQ situation in Kenya a utopia, but compared to what they're dealing with now without USAID, they did have a utopia. So this is very stark. Finally, the vertical relationships, negative perception of the U.S., spoiler alert, yes. Ties to other donors, yes. They're more cautious with the U.S. U.S. administration changes should not mean abrupt policy changes. We need time to transition. They absolutely do. Because you know what? These people that I have worked with are incredibly resourceful. And if you give time to transition, they will come up with amazing solutions. And that's what I want to end on, because I want to end on a little bit of hope. When a snake bites you, you don't stand there. You don't stand there, you move. These organizations learned from their experiences with the US and the global gag rule, and they learned how to move on. Over half of the NGOs emphasize the need for self-sufficiency. I was not asking about this. This is just a theme that emerged. Many shared their innovative money-making initiatives. We started a business model, social enterprise wing. This is sustainable. We set up a waste management social enterprise so that within our organization, we can address social problems and get economic benefits. My NGO is now a consultant with international organizations. We have the expertise and the evidence. We apply that and we tell them how to do it. When the USAID funding was cut, I was supposed to lose employees. I've lost no staff. I've hired 2 due to this consulting business. We are developing a community bank revolving loan fund and establishing a hostel to bring in income with tourism. I think it speaks for itself. They have a lot of energizing ideas, and they're not down and out for the count. They are in this, and they are committed, and they're finding a way through. So lessons learned, cooperation and adaptation are key. The experience of the Kenyan NGOs with the Trump administration's implementation of the global gag rule and their response to the 2025 USAID shutdown provides a model for how other NGOs may respond to extreme, widespread USAID withdrawal. And I'm just gonna put in a little plug. I am teaching spring quarter, Politics of Health and International Development in the Political Science Department. I think it's gonna be Poli-Sci 390, special topics. So if you are interested in things like this, we will talk a bit about USAID there. We'll also talk about the Sustainable Development Goals, the politics behind all of this. If that is something that interests you, I will be around this spring. So thank you very much. I also have time for questions. That will count as an elective for Global Health Studies for those watching through Panopto. Okay. Okay.
So we do have some time for questions. We have the room past 1, so if we need to go to 1:10 or 1:15, that's okay. There are plenty of questions. Because we're recording, I will hilariously run back and forth from the audience.
Great.
With the microphone for you to ask the question.
Donahue style.
Yeah,
That's
Donahue
old
style.
reference.
Yeah, they don't know who that is. Yeah. All right. Questions here.
We need this on Panopto. We need you recorded for others. Embrace it. Embrace it.
Hi, thank you so much for the lecture. It was incredible. I'm really curious if you've seen a pattern of other countries coming in to supplement. I know, like, on the board it said that they were working with Canada and I believe Sweden, but if those other countries have made a positive impact in supplementing some of the, like, funding that goes towards these NGOs.
that, both like as a political scientist and what I know, and then also from my interviews. It did not make it into the presentation for time constraints, but unfortunately, Europe is not stepping up this time around for USAID funding. One of the reasons is because security concerns are a much larger concern for Europe right now with the aggressive attack on Ukraine. And so they have a lot of money that they have been diverting to Ukraine and to try and shore up their security against Russia. So that has not happened. In 2017, when the global gag rule was last reinstated, there was a very big movement called She Decides that was led by the Netherlands, and over 50 countries signed on to that right away, and they raised over $650 million within the first year to cover the gap in U.S. funding for sexual reproductive health. But that was just one sector of literally hundreds of sectors now that are gone with USAID. So some countries are trying to do what they can, but it's not 2017 anymore, and the geopolitical situation, unfortunately, has just changed in such a way that they're not able to. I mean, but having said that, like, we don't get the official OECD data. That's the organization for that tracks the amount of like foreign aid spending for all of the DAC countries, and that won't be available for 2025 until probably, I mean, mid 2026 at the earliest would be my guess. So it's hard to, I mean, I can't quantify that for you yet. But the answer is no.
Thank you for speaking. My question is kind of around, for supporters of this withdrawal of USAID aid, how would you kind of talk about the responsibility of countries that have more wealth, more power? What is the responsibility to other countries? And then also, I don't know if you would challenge this idea of U.S. exceptionalism and how the U.S., has such a broad power over the affairs of everywhere in the world, but also balancing that with the fact that it's not uncommon for countries to be donating money to like international concerns. So just like, how would you respond to all of this to somebody who supports this withdrawal of U.S. aid?
Thank you. I would say that as a political scientist, I would say that, okay, as a person, I would say that we have a moral obligation to provide or to expand global health. We have enough resources in the world to do it, both financially and technologically, all of the things. There's no problem that we can't solve if we have the political will to do so. So I would say that it is definitely within our reach to solve these global health problems. But as a political scientist, I would say that a reason why you would want to continue to fund USAID is because of how it helps prop up U.S. power. I don't think the U.S. is extraordinary. I mean, one just has to open the newspaper to see that a lot of terrible things are happening here in the U.S. However, we have been a global leader for good in this realm, and we have saved hundreds of, millions of lives over decades of USAID interference, or not interference, but aid. And so the tiny amount, the less than 1% of the budget that it costs for us to do that, we get back in multitudes with goodwill, and then also just knowing we're not letting babies die. Also, I will say I don't have stats on this in front of me, but I have seen charts recently showing that, so USAID was famously one of the first agencies cut with the DOGE cuts, and there have now been charts coming out at the end of 2025 showing that DOGE actually didn't cut anything at all. They're actually doing more government spending than they were doing at the time of DOGE. So all of the money that went, originally to, saving babies in Africa is now going to probably funding ICE or something.
That was going to be my follow-up question, because that's often something I hear from people that even I know, and that's always my question is, where does that money actually end up going if we don't spend it on kind of foreign aid? So I'm thinking about the chart, the very first image of the presidents and how it alternates. I don't know if you know the answer to this, or someone who might, like someone you would recommend reading. What happens to the money during those switches? Like, where does that money end up going actually? Because right now it's probably for ICE. That's kind of like what we noticed. But with the other presidents, where did that money go when it was a Republican? And then how did they pull it out for the Democrats when they actually went back and kind of reversed it?
Thank you. So I'm actually working on a project specifically about that with a co-author. And I don't have the full analysis done yet, so I can't tell you. What I can tell you is that aid is very fungible, meaning it goes, not that I don't think you know that term, I'm just going to explain it. This is a term we use in political science, and I'm sure in other disciplines as well, to talk about that it can move pretty easily from one area to another. And so the foreign aid for the family planning sector, when it is withdrawn, it typically goes just to other sectors. So for governance or democracy promotion or something like that. So it can still stay in the aid arena, but it doesn't. But that's very cold comfort to the sexual reproductive health NGOs that are, providing life-saving care for the people in Western Kenya.
Can you hear me? I actually have two questions. One is the question, kind of separating out for a second the actual elimination of USAID, but from the beginning of your presentation, it's related to actually a speaker we had last quarter, Mara Cardis Nelson, and one of the things she observed was that people in these contexts actually are very used to these big swings, and so it's not a shock to their system, at least at the population level. And I was wondering if you could speak to that, because one of the ways your argument was framed was that this 2017 switch was like a big shock and it was really damaging. So I was wondering if you could sort of talk about the long term. It's predictable. It swings back and forth, right? That's one thing. And then the second question on the other side is I read recently that now what's remained of U.S. foreign aid is now, which is not much, right? But now apparently any NGO that does anything related to DEI, diversity, equity, inclusion, they can't do it or they won't get the aid, which basically means all global health, right? And so how are whatever organizations that are left being funded, how are they dealing with this ridiculous new directive?
Both good questions. On the 2017 front, I can say yes, the sexual and reproductive health NGOs that I have met with, they always knew that the global gag rule, was a possibility, right? But the reason why 2017 in particular was such a shock is because no one was predicting Donald Trump to win. And so I shouldn't say no one, like Michael Moore famously was, but that was not, the polls, things like that were not pointing in that direction. And so that was a surprise. Also in 2017, which I think I forgot to mention, but the Trump administration also expanded it to include other areas of global health as well. So it was a much more massive shock. I can say just my own research does show that even if they're kind of somewhat prepared for it, that they know it's in the back of their mind, you can't prepare for it 100% because you don't know until November 8th or whatever, and then you have 2.5 months and your funding will be cut. And yeah, so that was question 1. Question 2 was about DEI. So none of the organizations that I spoke with had retained any funding at all. The colleagues that I have at other universities who work on aid and work with other organizations have reported to me that, you know, it seems very random which projects have been allowed to continue and which have not. So like some will have like, or they'll try and frame it in a different way, like we're doing environment now, but you know, as we know, it's all intersectional. Oh, look, this is a great diagram to show. Health intersects with all of the sustainable development goals, right? And so you can say you're working on environment and climate, and you know, you're also feeding into some of the health and other needs. But yeah, I don't have a good answer for that second one.
Hi. So based on your experience in Kenya, I wanted to know what you think would be the most effective strategy for NGOs. Would it be like building long-term self-sufficiency and maybe diversifying funding sources, or is it more of like advocating for the reinstatement of aid, given that with the presidents of like the pictures of the presidents, we see that it's probably going to happen often. So yeah.
That is a great question. I think that global health is big and diverse, and we need help from all different angles, right? And so I think if an organization wants to spend their time on advocacy, that's a great way to do it. If another organization, you know, wants to look into self-funding, that also is a great strategy. I know that might kind of sound like a wishy-washy answer, but I think oftentimes we spend so long like looking to do the exact right thing that we miss out on doing something that's good. And that old adage, like the perfection can be the enemy of the good, I think really does matter. I think it's important that we just do something, whatever it is that we're comfortable doing. So some of these NGOs were, as you saw, were very entrepreneurial and really wanted to dig into that, and probably had some connections that helped them facilitate that. And others, you know, talked about, which I didn't show on the slide, but others talked to me about, you know, now we're just trying to continue to link up with other organizations. We're bringing the little that we can, because when we all come together, we can have a bigger impact. I know they are working hard on advocacy in their own country and also beyond. I mean, we need everyone helping in whatever way they can.
This question kind of goes similar to that question as well as your answer. I know this wasn't exactly the focus of the talk, but I was just curious, do you think that like USAID would be more hesitant to fund Kenya and like their healthcare NGOs if they do accept and obtain funding from BRICS, which is kind of like the other organization that you were talking about?
That's a good question, and I think it depends on who is running USAID and how much of that like principal agent issue we have, how much monitoring and enforcement goes along. It has been that in the past, you know, so like typically if an organization can apply so USAID will put out a call for proposals, say, you know, we're going to fund an activity, or we're going to fund like a decrease in teen pregnancy, right? So then NGOs come forth with a proposal and say, we want to do X, Y, and Z in order to decrease teen pregnancy. And it just depends on who's in charge of USAID. Sometimes they'll want to then say, okay, who else are you getting money from? And then they're, you know, really monitoring. Other times they say, that's great, you can do whatever, you know, we'll give you money for this project, and they don't really get into the other finances. I do know from another project that I did, and it doesn't show up on here, but I've had many NGOs report to me that during the global gag rule years, they said specifically, like, you can't have money from the Dutch and the US. The US won't allow it, and also the Dutch won't allow it, because the Dutch will say, we only want you giving comprehensive sexual and reproductive health care, which includes abortion, and the US says, we will only fund you if you do not do abortion. So they're just incompatible. So it depends on how much they're monitoring.
Thank you for this talk. It's actually because my work is in Tanzania and it's in government-funded health facilities. The lens is really interesting to hear about the NGOs. I'm going to ask you a question that's kind of outside of the NGO perspective, so you may not, you might have to just sort of, this is what I heard on the street. But I'm curious about how people are talking about the responsibility of the Kenyan government to be able to take over, because one of the things that's very clear through here is that the donors are really dictating what the priorities are going to be in global health, right? And this has long been a critique within scholarship is you know, the vertical funding, the very narrow parameters of how donors are thinking about what gets to matter and what doesn't. You can get excellent HIV care, but not any good care for diabetes in Kenya, et cetera. And so I'm curious, how are Kenyans talking about the government's responsibility to actually pick up some of the slack and think more comprehensively about more robust health system strengthening?
That is a great question. And now you are talking like a political scientist, because you're talking about issues of power, right? Like who gets to set the agenda and all of that stuff. So yes, average Kenyans, and this also came up in my interviews, I just did not present it here. Some that were a little more hopeful were saying this is a wake-up call, but it's an eye-opening opportunity for us to pressure the government, the Kenyan government, to actually fund these things that need to be funded, to make sexual reproductive health a priority. Because for too long it's been, the agencies will work on that. The donors will give you money for that. We don't have to invest, the Kenyan government money into it. So there is a movement to hold the Kenyan government to account, which I don't think is a bad thing. There is a lot of, there just aren't as many resources, though, is an issue, right? And so where is that money going to come from is a problem. I guess I should say really fast, I don't think that the U.S. has all of the answers. And I know USAID is flawed in many ways, but I also know that it saves, tens of millions of lives. And so to have it be eradicated in such a way without any transition, one of the quotes said that, there was no transition period, is just, it's more than a shame. It's criminal because people are dying. So is this a time to imagine a better world of possibilities? Yes, sure. Should we hold individual governments to account? Yes, but also there's just some huge GDP disparities between countries, and those of us who have can be doing more. Should we cut back on tide aid, that forces people to use the money in certain ways? Absolutely. Are there ways that we can talk about this in the context of decolonizing global health? Absolutely. But I think the immediate, concern is that it's unclear where the Kenyan government can get all of that money at this point in time, and people are dying every day because of it. And on that note, sorry.
This was a terrific.
Thank you.